All right, good afternoon, everybody. We are a little late here, about 25 minutes late, but we are having some technical difficulties. My name is Jillian Parker, and today we are joined by Dr. Nana Duffy. Thanks for joining us today.
You're welcome. It's good to be here.
Today we're touching on hair, skin. That'll be the focus. What decisions you could be making for yourself while you're social distancing at home. It's the perfect time, I know, to take care of your skin. I've been doing it. I know a lot of others have been trying to do it. So we want to know what Rochester Regional Health is providing as far as consultations, sessions via technology with professionals like yourself. And remember, everyone who's watching, if you want to leave your questions in the comment section, we'll circle back around at the end to answer anything that you've left. So Dr. Duffy, I just want to start out with, everyday routines have been altered a bit, but your skincare routine does not have to be one of the things that change. In fact, can actually probably be doing more. So how is it why is it beneficial at this time at home to be using certain products? I know chemical peels is one thing I've seen a lot of people using because it leaves their face red for a while, doesn't it?
Yeah, so I think there's a lot of things that people just have that they would typically do, nothing out of the ordinary, but that they just don't really have time for. So something very simple like cleansing your face. As a mom, I know that sometimes the day is just so busy that you use a wipe, or sometimes you go to bed without cleansing at all. So something very simple in terms of just cleansing your face twice a day, I think is something that we're finding time to actually do. But some more advanced things that you could be using this downtime for would be things like at-home chemical peel systems, which you can get online from places like, Sephora or beauty supply stores. Most chemical peels will contain either beta hydroxy acids or alpha hydroxy acids. So things like glycolic acid, salicylic acid. And for most patients, they can be a little irritating, and, they're called chemical peels because they tend to make your face kind of dry and peely. And it's something that you can do if you have downtime that maybe ordinarily you wouldn't find the time to do because you can't afford to be dry and peely out in public. So chemical peels are a great thing to be doing. It's a really great time to be started on a retinoid, which is basically, retin A. They're derivatives of vitamin A that we use as creams or serums or gels, and they're usually used at night. And, the purpose is to basically stimulate collagen production and treat fine lines and wrinkles, although we use them a lot for acne. So people that are prone to blemishes, this is a great time to start to use a retinoid. Again, it's because you go through a process where you're a little bit irritated, a little bit peely, and this is a great time to get used to that and not have to face the world,
And I know while people can be doing some of these routines at home, you said the other day when we spoke that you've still been busy. You've still been seeing a good amount of appointments. So what is currently being provided for current clients?
Sure. So I would say 95% of our visits right now are video visits, and we're doing them either through the EMR, or in some situations, we're doing them via Skype or FaceTime. If patients don't have access to any of that technology, we're happy to do telephone visits, but the video visits are helpful because especially in dermatology, you really need to see the patient's skin. And then a very small subset of patients, that we think are very urgent issues are coming into the office, as kind of in-person visits. So we're doing mostly video visits to accommodate our patients. And, we do a mixture of general dermatology and cosmetic dermatology in general. So while we can't have people coming into the office at this time to do cosmetic consults, we are available to do cosmetic consults via video chats.
And that was actually my next question. So even new folks can still get interested and have an initial consultation with you via telemedicine, right?
Right. And actually, something that's really exciting is that we just recently, within the hospital's electronic medical record, which is called Care Connect, we just recently, this was in the past couple of weeks, turned on the ability for patients to upload images. So it's possible for you to actually upload an image of your skin directly into your patient portal, and it gets tucked into your own medical file for your doctor to view.
And
So
how can, I was gonna say, how can people access that?
Oh, so if you want to schedule a video visit, you would just call one of our offices. We have multiple dermatology offices across the county. Some of them are kind of centralized, some of them are on the east side, some of them are on the west side. So you just call one of our offices and make an appointment with a provider, a doctor, nurse practitioner, physician assistant, and then you have to get set up for My Care, which is your patient portal. And then you would basically just send your doctor or your physician assistant a message, and you would attach your photo to that message. So that's how the images are coming in.
And I know we also talked about this the other day. I'm going to assume there's going to be an influx of calls and appointments when we return to normalcy. So how important is it that already scheduled visits people aren't postponing, that they're doing via telemedicine if possible, still during this pandemic?
That's a really great point. You know, if we could, we would see all of our patients in the office like we used to, because we love our patients and we miss them. But like you said, what's happening is because of the pandemic, we've had to push patients out and push them out. And so we're getting to a point where we want to make sure that we're not missing things, you know, like skin cancers and urgent issues. And so if it's a visit that's appropriate to be done via video visit, for example, you know, acne or, you know, a single lesion on your skin that you can take a great picture of and send it to us. Rashes are a good example of things that can typically be handled via video as long as we have a good image. So if the doctor thinks it's appropriate for a video visit, you know, just know that while we would love to see you in the office, we're really trying to tuck those patients that really need to be seen. We're trying to make room for them, and then make a separate category for things that can be handled via video.
Now, if you find a dark spot or a raised spot on your body, what should people do? How often should they be checking their skin at home?
Yeah, so that's a good question. This is actually a great time when people are, you know, sheltering in place, for people to get used to doing skin exams on their own bodies. And I typically recommend that people do it 4 times a year. So just think about when the seasons change. So right now we're going into spring, and so it should trigger you to do your self skin check. And then when we go into summer, so just do it with every season so that you end up doing it 4 times a year. And basically what you do is just find some good lighting in your house, and you want to look at all of your skin surface, you know, your arms, your legs, your trunk, the back of your legs, the palms of the hands, the soles of the feet, and that you're looking for moles or growths that just don't look like they belong on your skin. They don't look like a normal, you know, inhabitant that you recognize on your skin. And you do want to ask a family member for help to look at your back and places like your scalp that you can't see. You know, it's really kind of impossible to see things on the middle of your back or on your scalp. So just ask someone to have your back in terms of checking your skin on those places that are a little harder to view. But if you find something that you're concerned about, there are a couple of different options. We are available for patients that are really worried, that really think that something needs to be evaluated in the office, especially something that's symptomatic, meaning it's growing or it hurts or it's really itchy. So things that are symptomatic or that you're really worried about, we can see you in the office, and we're taking, precautions to keep you safe and to keep us safe. But if you wanted to send an image, I've found that the video visits are reasonable for rashes, but for an individual lesion, the image that you get from a video is sometimes not enough, and we actually need to have a picture of that spot as well. So as long as we can add the picture to the video component, we're most of the time able to evaluate single lesions that people are concerned about. There is one exception, okay? Sometimes with dark moles that are flat, we like to look at those with a special tool in the office called a dermatoscope, and we just can't do that over video. So we'll let you know if it's something that we really feel like you need to come in for us to thoroughly examine.
Okay, yeah, it's a good point to get across. And how are you going about distributing certain products or medicines that people might need at this time?
Yeah, so in terms of prescription medicines, there are many pharmacies that will deliver to patients' homes. So that's a nice thing when the pharmacy can actually, deliver it to your home. But for things like cosmeceuticals, which are, skincare products that are only sold in doctor's offices, so our Aven or our Glytone line, we're mailing those out to patients, and not charge patients for shipping. So we can always mail things out to you if you need them.
Now, I know that our faces, they're used to whatever routine we go about, and a lot of people, myself included, with the exception of today, are wearing a lot less makeup.
I know, this is the first time I've worn makeup in like 2 weeks.
I wear it about once a week when we do these Facebook Lives. So what is it? How exactly does our skin recognize and respond to the fact that we're wearing so much less product on our face these days?
Yeah, so I always feel like if you want the kind of skin where makeup is not required, right? Where you're not trying to cover something or camouflage something, then I really feel like you should spend as much time as possible letting your skin, quote, breathe. Mm-hmm. And that really just means like not layering on, primer and then foundation on top of that, and then bronzer on top of that. Even the best skincare products, and once you start layering on product after product after product, it makes it difficult for the skin to kind of do its proper function. So I think this is a great time to be as makeup free as possible. And I think you'll find that you'll come out of this with skin that actually requires less makeup in the long run.
And because people are wearing less makeup, is there anything in addition that they should be doing, just with the exception of making sure to actually wash your face with cleansers, and like you said, not just using a pad across your face?
Yes. So if you have downtime, which many of us do, this is a great time to give yourself an at-home facial, because you're not going to be able to go into a spa. I mean, not now. Hopefully sometime in the future things will change, but you can't get a facial these days. So you can recreate it at home. It's a great thing to do on a, Saturday or a Sunday. You get yourself that candle that you've been saving for a special occasion. You light the candle. You fill up a big container of water on the stove, like a pot of water, boil it, get that water really hot. Once it's boiling and it's steaming, maybe you slice up some lemons or put a few drops of aromatherapy oil in the water. You turn the heat off, and then you can even move that pot from off of the stove if you want. And then you take a towel and you basically do this process of steaming your face. So it really kind of hydrates your face. I suppose you could do the same thing in the shower, but the steam from a pot of boiling water, I find, works a lot better. So basically you take a towel and you put your head carefully over the steaming water to let the steam kind of hydrate your face. And then once your face is hydrated, you want to exfoliate it. So that's the next part of a facial. So you get yourself an exfoliating scrub that maybe you've purchased online, or you could recreate a scrub with some at-home ingredients. Just get some honey and sugar, or honey and salt, depending on how gritty you want it to be. And then you make a paste and just kind of gently exfoliate all those dead skin cells off the face. Then you rinse that off. And the last step is just a good moisturizer. So generally speaking, if your face is really dry, you want to pick a cream rather than a lotion. So something nice and thick that comes in like a tub, not a pump bottle. So a nice thick cream, and just, put a thin layer on. And that's a nice way to create an at-home facial.
You can have a little spa day right at your own house. You have
Right.
been wanting to do that a little later today, actually.
You deserve it.
Now, the weather's been kind of off and on, so people maybe not spending as much time outside. Does that factor that we're not outside as much, not in the sun as much, how does that affect our skin?
Sure. So it certainly means that people are decreasing their risk of getting sunburned, which is good, because every sunburn, kind of can increase your risk for skin cancer. And so that's one thing that I'm thankful of. I don't want to give the impression that, as dermatologists, we don't want people to be outside, because it is good and healthy to be outside and active. But we do want people to protect their skin when they're out there by either wearing protective clothing or an SPF that's 30 or higher. But if you're staying indoors, you're really not having to do that at this time. So I suppose it's possible that that we're going to see less sunburns because people are staying inside, and then potentially that translates into a lowering of the risk for skin cancer, maybe for an individual patient.
Now, we've been talking about skin a lot. I want to ask you a question about hair, because not as many people are doing it. There's not really a need to do anything too fancy right now.
And that's the whole point. It's the concept that really the least you do in terms of heat and chemicals and styling to your hair, the healthier it's going to be. So I have my hair natural today. I didn't straighten it. I haven't put, a flat iron to it. And so cultivating those practices of basically doing as little as possible to your hair is just on the other side of this quarantine. We're going to, I think, actually come out of it with healthier hair and healthier skin, because we're not doing those damaging processes that we used to. So really, the message is limit the heat, limit the chemicals, because there's, you don't have to, and treat your hair with some TLC in terms of maybe doing a deep conditioner or a hot oil treatment, something like that.
As far as deep conditioners and masks, is there a certain amount of time that is there such a thing as overdoing it as far as they're concerned?
Actually, yes. So, most deep conditioners are not meant to be left on. And if you leave a conditioner, even a deep conditioner, on your hair for too long, it can actually start to denature the hair shafts and damage your hair. So, if something is labeled as a leave-in conditioner, that's different. It's intended to stay on the hair shafts. But if it's, if the package says to rinse it out after 3 minutes, that's what you should do. Otherwise, you really could create some damage.
Okay. Before we leave you today, do you have any last tips or words of advice for people?
I just want to encourage people to take care of their mental health in addition to their physical health. I think if you're paying attention at all these days, you're stressed out. We're all stressed. And so I just want to say that sometimes the process of grooming, you know, in terms of grooming the hair or grooming the skin, it can actually be kind of therapeutic. So just take the time on a Saturday or Sunday and just give yourself some, you know, some TLC emotionally and physically.
Now, I have one question from Facebook before I let you go.
Yeah.
Someone's asking about keeping our hands healthy during this time just because of all the washing that we're doing and the sanitizing. I live in an apartment building. Every time I take my dog out downstairs, I come back up, I wash my hands probably a dozen or so times a day.
Yeah. So a couple of things about that. First of all, washing your hands with soap and water is going to create less damage than using hand sanitizer. And we all know that it works better anyways, right? It gets the germs off better than using hand sanitizer. But it's actually healthier for your skin to use soap and water rather than hand sanitizer. You know, sometimes you can't help it and you're out at the grocery store and hand sanitizer is all you have access to. But just in general, kind of lean more towards soap and water than hand sanitizer. And then after you wash your hands and dry them off, it's okay to put a moisturizer on, you know, as long as it doesn't contain a whole lot of fragrance. It's okay to put a moisturizer on after you wash your hands, and you'll go a long way to keep your skin healthy if you do that.
If there is a fragrance in it, should that be limited, that specific product?
Absolutely, because basically what you're going to do is create a situation where your hands are so dry and the skin cells are so broken apart that fragrance is going to start to irritate, and then you're going to develop an actual rash. So a good fragrance-free moisturizer after it's okay to do it after each hand wash.
Dr. Duffy, thank you so much for taking a little time to talk to us today.
No problem. Thanks a lot.
Thank you for everything you're doing, and be safe. We, again, will be having a lot more discussions for folks tuning in. If you have any more questions, please leave them in the comments. We'll try to get to them a little bit later on. Dr. Duffy, thank you. And everyone, take care. We'll see you next time.
You too. Bye.